Hello, I'm Dr. Roy Picard, and this video is primarily for the parents of a child who has been diagnosed with having tics or Tourette syndrome. I'm a licensed doctor of chiropractic in Shelby Township, Michigan, but what I utilize in my office is chiropractic neurology, functional endocrinology, nutrition, and brain-based therapies. I became board eligible in chiropractic neurology back in 2006, and in 2008 I became a certified DAN doctor, DAN referring to Defeat Autism Now, and that was certified through the Autism Research Institute. Now my specialized postgraduate training, along with my 22 years in practice, is what allows me to effectively work with these kids to allow them to decrease and in some situations totally eliminate their tics without the use of any drugs. Now whether we're talking about Tourette's or specifically tics, obviously we are not dealing with a life or a death situation. However, to the child who has this, especially in severe cases, it may seem like a death sentence. My heart goes out to these kids and their families. I mean, let's face it, we all know how kids can be cruel, and adding this unwanted attention to a child can be devastating, even for the adults who are afflicted. This problem can lead to social isolation and depression that can totally destroy an innocent child's life. Families are not only having to deal with their child coping with the stigma of the syndrome, but also the concern over the different medications that are sometimes recommended for severe cases. Typical and atypical neuroleptics, antipsychotics, antihypertensive, and stimulant medications often bring about a great deal of worry for the parents whose children have severe cases of Tourette's. Counseling can often benefit a child in their ability to handle the social misunderstanding, but nonetheless, they are at best just learning coping skills. Sure, in time, the, let's say, neighborhood and the school, they may become more understanding of what is going on, but sooner or later, the child leaves their comfortable school and neighborhood to go places such as shopping, out to eat, entertainment, and then, depending upon the level of symptoms, the uneducated society just reminds the child that they are different, and it is hopefully at this point in time that the child's coping skills can allow them to handle the unwanted attention. Unfortunately, there is only so much that a parent can do to shield their child from all of this. So the purpose of this video is to let you know that often there can be drugless types of care offered to help these kids. Obviously, when looking at tics or Tourette's, the main focus has to be centered on the brain and nerve system. When studying the brain, you will eventually learn that the brain requires two things: stimulation and fuel. When the brain is working properly and in full communication with all areas and different lobes, optimal physical, mental, social, behavioral, and academic performance is achieved. If one or, let's say, more areas of the brain are not functioning to their optimal level, if they are not in sync with the rest of the brain, then what can occur are tics and other symptoms and comorbidities that are associated with Tourette's. I work to uncover the core issues as to what has led your child to their diagnosis or suspected diagnosis. Children with tics and Tourette's all show an imbalance in the brain known as a functional disconnection syndrome. It doesn't mean that there's anything broken with the brain or that surgery is required. I'm not saying that. It just refers to the fact that the brain no longer is in full communication with all areas or lobes. With proper testing, it can be determined if one or more areas or lobes of the brain are not working in sync with the rest of the brain. Are there certain areas of the brain that can lead to tics? Well, absolutely. Specific activities in brain-based therapies to these out-of-sync areas of the brain can then be stimulated or exercised to become in sync with the rest of the brain, which has proven to decrease and, again, in some cases, totally eliminate the tics. Something else to consider is that when we are looking at brain function, it is extremely important to make sure that there is proper nutrition or, let's say, fuel to the brain. Without proper fuel, the brain is going to fatigue, and this will lead to an increase in symptoms that your child is suffering with. With proper testing and analysis, an individual's body chemistry can be evaluated to determine if nutritional support is necessary to allow the brain maximum function. This part of the care, referred to as metabolic care, is achieved by specific questions and specific types of lab work and blood work and other types of tests. Understanding what nutritional support is required in the body will allow you to change your child's diet in order to support healthy brain function. Remember, we need to locate and exercise the weaker lobes or areas of the brain, but in order to do this and not have the brain fatigue, proper nutrition will be necessary. So if you are interested in finding out what can be done to help your child, then let me explain what the next step is for you to take. Call my office and schedule a free consultation. During the consultation, I want you to tell me specifically what is going on with your child, what your child is going through, what you have tried to do to help, what has worked, what hasn't worked. Basically, I want to hear what your expectations are so that I know if they're realistic or not. I'm going to give you a greater understanding of what I do, how I can help your child, the types of testing that has proven to be beneficial, the different care that has proven to help children like yours, as well as your responsibilities regarding home therapies, diet, and other lifestyle changes. I will try to answer all of your questions for you so that you can decide if this type of care is what you feel is best for your child. So again, if you would like to meet with me for a free consultation, this would be a really good place for us to begin. I wish you, your family, and of course your child nothing but the very best.